With energy, the salt talks, and the Panama Canal so much in the news, you might not have noticed that national health insurance is moving up on the outside. I'll be right back. For purposes of clarity and outright honesty in discussing proposed national health insurance plans, I shall refer to them as socialized medicine, for that's what is really being proposed. A series of regional meetings sponsored by the Department of HEW has been scheduled, and the first one took place recently in Washington. The hearings, of course, have to do with socialized medicine for America. If the Washington meeting was an indication of things to come, the only question to be decided is which proposal for socializing health care do we get. There didn't seem to be anyone present putting in a plug for the system we've been using, which happens to offer the best medical care in the world. Let me ask you, do you think there's a health care crisis in the United States? If the polls are correct, 9 out of 10 of you first said yes. But now let me ask you about yourself. Do you have ready access to a doctor if you need one? Are you relatively near to hospitals or medical centers if you should be in need of the services they offer? Would it be impossible for you to get medical help in a reasonable time in case of an emergency? Again, if the polls are correct, 9 out of 10 of you answered yes to those questions. In other words, 9 out of 10 of you have been conned into believing there is a health care crisis, but 9 out of 10 of you think it applies to someone else. We have the highest ratio of doctors and nurses to patients in all the world. Less than 0.5% of our people live in counties where there is no hospital or medical treatment center, but most of those aren't more than 25 miles from such a facility. The L.A. Times recently ran a pro-con set of articles on socialized medicine. They used the other name for it. The advocate for it ranted about greed in the healthcare field. He ended up with proposals for tens of thousands of new doctors and nurses, all trained at taxpayers' expense, every doctor and dentist on government salary, public ownership of all drug and medical equipment companies, and then said all of this could be provided for only 80% of present healthcare costs. That must have been his laugh line. Total healthcare costs last year were $140 billion, a tidy sum. But Senator Kennedy and Congressman Corman's plan is priced by HEW at $248 billion. The second most popular plan, and one which I'm sorry to say some defeatists in the Medical Association have caved in on, would cost $243 billion. Then there's one the insurance companies think they could live with, and perhaps on, which would cost $234.5 billion. All of these are from studies by HEW, which of course is heart and soul in favor of socialized medicine. And yet our crisis-ridden present healthcare system costs around $100 billion less than the best government can come up with. Maybe there's a clue to these contrasting prices in some statistics about patients in government-run hospitals and in private hospitals. Medical patients spend an average of 8 days in private hospitals. The same kind of patient in our veterans' hospitals linger 26.5 days. Nursing costs per private patient average $218. In the VA hospitals, it is $580 of our tax dollars. Why don't we let well enough alone? This is Ronald Reagan. Thanks for listening. On my last broadcast, I compared some health care cost figures for private hospitals and for those run by the government. Today, I'd like to talk about some other comparisons we should be making. I'll be right back. The believers in socialized medicine, which for selling purposes they refer to as national health insurance, occasionally try to arouse our guilt feelings by saying how far we are behind other more enlightened nations. They talk of a total government medical program replacing our present pluralistic system of government help for the needy plus private fee-for-service. But they shy away from any actual comparison with nations which have total government-run health care. One of the most persistent advocates of government medicine, Senator Kennedy, visited a nursing home in Denmark for 2 hours and was quite pleased with what he saw. Apparently, however, he never heard the Danish administrator of their socialized health plan say, "Don't ask me how to control medical costs." Virtually all of Europe's socialized medicine is afflicted with rising costs, underfunding, bureaucratic ineptness, decline in quality care, overusage, personnel and facility shortages, and lack of capital for scientific modernization. In England, they've resorted to cutbacks and sweeping reforms. Still, a senior official says, quote, "Yes, we've gone too far. Waits for medical service are growing longer, fees have doubled." An English sociologist says medical nursing and paramedic personnel, most of whom enthusiastically accepted the challenge of British National Health Service and enthusiastically tried to treat patients as patients, are now soured, disenchanted, and militantly organized in their own special interest. Public administrators override the independence of professional medical opinion. Progress raises expectations which can't be fulfilled. The best professionals are few in number, therefore it's impossible for more than a few to receive the best care. The latest scientific techniques rest upon expensive equipment, therefore only a few enjoy its benefits." End quote. Then came this telling line, quote, "Neither socialized nor private medicine can change these basic facts, but socialized medicine induces the belief that it can." A year or so ago, the people of Sweden voted Karl Marx out after 40 years of socialism. Maybe this statement by a Swedish official explains why. It sounds a little like England. Waits for medical service are growing longer, fees have doubled, the new hospital in Stockholm stands half completed for lack of funds, doctors leave the country in the summer to escape confiscatory taxes. The income tax rate at $33,000 of earnings is 102%. Alcoholism, drug addiction, VD, mental illness, and suicide rank among the highest anywhere. Is there anything in these comparisons to make us want to imitate any of them? As I've said before, you can't socialize the doctors without socializing the patient. Isn't it time we as patients gave the doctors a hand in their fight to keep medicine out of government's hands? This is Ronald Reagan. Thanks for listening.